be time for my weekly spanking.
Good
morning, good morning. Come on over. You know what's incompatible with the institution's image? Me speaking to the media about people who code in our waiting rooms and people who get shitty care in our hallways waiting for an ICU bed for days.
Stop. Call it. Nursing home just faxed us a DNR.
You kidding?
Power out the defibrillator and the lupus.
Complete waste of time and money. Who the hell works at that place?
A nurse taking care of 60 patients who couldn't find the form.
She called 911 so she could take care of the others.
Okay, let's move her to the viewing room and notify the family.
Yeah.
One of the things we do here is to take a moment of silence when we lose a patient. To respect their humanity and also to remember that this was somebody's child or sibling or parent, friend. Whoa, whoa, what's going on?
Mom's worried about a CYF.
Amanda!
Okay, enough! This is a hospital. This isn't the Jerry Springer show. Ma'am, nobody's trying to take your child. So why don't you stay here with him while your husband talks to our social worker outside and straightens all this out?
Well, I don't want him speaking for me and my son.
Well, it is either you or him. Your son is not leaving, but you can be escorted out and even arrested if you refuse to cooperate. Nobody wants that. So you tell us, what do you want to do?
I'm staying with my son.
Okay, great. You do that. We all on the same page here. Thank you, Olson. You okay?
Yeah, we got this.
All good.
It's all yours.
So this is...
Is that Dr. Robby? You owe me a dance.
Looks like an opportunity to boost your patient satisfaction.
Well, I am a little rusty, but let's give it a go, shall we?
Mm-hmm.
Ready?
Have been successful at is proving repeatedly that you know nothing.
Dr. Langdon? Is the patient stable?
Temps 1 and 2, just about to take her out of the ice.
Proceed. Dr. Langdon, a word, please.
Look, I know that sounded rough, but you only caught the tail. I can give you a list of
Stop
She was giving
talking.
unsupervised.
Knock it off. Shut the fuck up. Where does it say that shaming, belittling, and insulting are effective teaching tools? Let me just tell you, harassment has zero educational value. You feeling upset? She's getting under your skin? Check yourself. Take a break. I've been watching you ride her. This kind of behavior will not be tolerated. I don't want to see it.
I'm sorry. It won't happen again.
Where's your other one? Where's Mel?
She's taking a break.
Yeah, well, maybe go find her and see if you can get her back in the game. You are senior leadership here. Step up and act like it.
Glad to know the authorities are looking for this psycho, but what are you going to do to protect the rest of us?
Violence against healthcare workers is a national problem.
And it's only getting worse.
No surprise, there's a nursing shortage everywhere.
I hear you, and it is unacceptable.
What the hell kind of circus are you running down?
God, you're like a bad penny.
Where is Dana? Where is she?
She's all right. We sent her to CT to make sure.
Did you fill out an incident report?
I don't know. I was more concerned with her having a skull fracture than with your liability.
Guy from the waiting room get back here without anyone
Wow,
noticing.
Gloria, what a great question. Our hardworking nurses were just asking me what steps the hospital plans to take to ensure their safety in the future. Maybe you'd like to explain to them why you've denied my request for additional security measures 3 times in the last 4 months. If nurses don't feel safe, they're not going to come to work.
First off, the safety of all our employees.
Do you remember the last nursing strike?
Yeah, that was a real shit show.
Maybe this is something our union rep should know about?
Okay, but just take a beat and remember that PTMC is a family. Come on.
Dysfunctional family.
You should be worried about the nurses' satisfaction and the safety.
Yeah, worry about everyone. Robbie.
Dr.
I heard there's been some inconsistencies with meds intended for your patients.
What?
Frank, have you been helping yourself to benzos from the ER?
Yeah, I've been stealing blood, too.
I asked you a question.
Wait, are you serious? What are you doing? Really? Santos. Whatever the hell she told you is bullshit.
I didn't mention Santos.
You didn't have to. I told you She is trouble.
Have you ever taken a patient's medication?
This is insane. This is completely fucking
I
insane.
need you to open your locker.
Yeah, right.
Open your locker.
You're gonna regret.
Open your fucking locker, or I will have security smash it open. Is the imprint code on these pills going to match Louis' Librium? Go home, Frank.
No, it's not like you think. You remember whenever I helped my parents move, I was too cheap to pay for movers. I hurt my back. I told you that. You teased me about it. Remember? Well, our own Dr. Hagen prescribed me some pain meds and muscle relaxers. I was just weaning myself off. It was just for maintenance. I'm done. Robbie, come on. You know me, Robbie. You know me, man. I'm sorry. I fucked up. I was trying to.
What, steal pills?
No, it's not like you don't understand.
I don't fucking understand.
It's not like you think. I'm not high. I'm not high. You've seen what I do, Robbie. Could a drug addict do what I do?
Apparently. I just fucking let him. You're done. Leave now, or I will have Ahmad escort you out.
Robbie, please.
You are done. What? Because anybody can be an addict. You are proof of that. These pills that you are taking, they're not helping you with your pain. They are keeping you stuck in it. A lot of really good people struggle with addiction. It is a brain disease, but social environment and personal choice are also factors.
I don't have a
the
problem.
The good news is that the brain is highly dynamic, as is the environment, but you need to stop now before the damage is irreparable.
No, screw this hospital, okay? And screw you.
Hey, Dr. Mohan will advise you on our proposed action plan. You can either choose to follow it or not. That is entirely up to you. I wish you luck, Mr. Puglisi. No?
Then this nightmare.
Jesus! Gloria! The police are still looking. Why don't you go back to your micromanagerial ivory tower and let us get the fuck back to work?
All right, I'll go in there with a pressure bag and such.
You put your damn phone away. Your son is critically ill. The longer that we wait, the higher the risk of permanent brain damage. What is not clear here?
Hillary, he has a tube down his throat.
They're
He can't
not
breathe on his own.
poking holes in my son's spine.
Wow.
Let's just wait and see if he gets better.
Dr. King, could you please take Flynn's parents to see their daughter?
No problem.
They are going to see their daughter.
Fucking Dr. Google bullshit. They want medical treatment, but they don't want medical advice. What the actual fuck are we doing?
Yeah, I know, and we'll keep trying. You okay, boss?
Yes.
Sorry, Whitaker.
Whoa. What's going on here?
I disabled my ankle monitor because it was going off and fucking with our ability to help patients during the mass casualty.
Tell that to your judge.
This is my resident. I need her. Call Gloria. Can you at least wait a second, speak to our chief medical officer?
No, but they can call the department if they have any
We
questions.
just came through the worst mass casualty incident in this city's history, and you two are fucking around with this. Are you serious? You don't have anything better to do?
Thanks for letting me come back.
I didn't let you come back. You came back on your own, and I let you stay. Figured it was one time throwing my career away was for a greater good.
I was never high. I was just treating my own withdrawal symptoms.
Well, you should have done that under the care and supervision of a physician.
With that on my record, I could have my hospital privileges denied whenever I apply for a job.
No, that's not true anymore. That's not true anymore. You could have come to me. Instead, you could be arrested on felony charges for stealing controlled substances from the hospital.
Robbie, I could lose my medical license. Come on, man. You never heard of second chances.
Here's your second chance. 30-day inpatient treatment program, followed by random urine tests, 50 to 60 a year, followed by mandatory NA meetings 3 to 4 times a week for the first 3 years.
3 years?
Of a 5-year program. You need help.
What about you, man? What about you? I'm not the only one who's a little fucked up here, Robbie. Why don't you look in the mirror?
What's that supposed to mean?
I never had a complete meltdown.
No, you just cause them in other people.
You're blaming me for what happened to you.
What happened to me? What happened to me?
Yeah.
Oh, you are so full of shit. You let me down. You let everybody down, especially yourself.
Someone saw you in peds.
Who, Whitaker?
No. A night shift nurse. Saw you on the floor, said it looked like...
Look like what? Look like what? This job will fuck you up if you let it. You let it.
Yeah? I wasn't the one talking to cartoon animals in peds.
Fuck you!
What have we here?
Well, looks like 2 old white guys poached our patient.
Oh, I know you're not talking about us.
Well, I know he's not talking about me.